This is Steve Zeltzer with WorkWeek. The crisis for healthcare workers, frontline workers, is growing more and more dangerous and, in some cases, deadly. In San Francisco, at the Department of Public Health, workers face the danger of being contaminated without any proper protection, education, and training. Joining us is Cheryl Thornton. She's a member of SEIU 1021, a Department of Public Health at the community centers, and has been fighting for proper protection for herself and other workers. Welcome to WorkWeek, Cheryl.
Hi, Steve.
So, Cheryl, why don't you talk about the situation at the Department of Public Health and how yourself and other workers are being protected or not protected by the epidemic, COVID-19 epidemic that's now engulfing San Francisco and the whole world, actually.
Well, Steve, this is all new to us, all of us. And so what I've seen in the Department of Public Health is this is an evolving process, and it's in its infancy stages. And so what I mean is around policies and procedures for this environment that we're currently in, there's not a lot of policies. The managers and directors are not updated on the policies for COVID-19 via the CDC, via the Cal OSHA about COVID. There's guidelines, and they're not adhering to them because the managers in DPH just aren't up on what's going on, and all they have is you're an essential worker. You have to come to work regardless of an illness, an underlying medical condition. You have to come to work. We cannot supply you telecommute, no options. So that's what's going on. And it tends to impact what we're seeing so far is in the Department of Public Health. Me and a colleague of mine, Brenda Barrows, what we're seeing is that Black and brown workers are not allowed to be in positions where they can telecommute, do their job from home, protect themselves from getting COVID-19. And there's a huge disparity. So, yes, that's what I see in the Department of Public Health.
And the issue of education and protective masks and protective screens, you're dealing with the public who are coming there. Has that been made available to you and the other workers there so that you are protected if people come to your location?
So I worked at Southeast Health Center in the Bayview, and we were asked late last week, to man the screening table. The screening table for people who were coming in with COVID-19 concerns/symptoms. And so initially we started in the clinic asking if they had cough and fever. But then I guess every few days the CDC comes out with new guidelines about how we're supposed to stem the spread of COVID-19. So then it moved to a table at the front doors of the clinic. We would have to we were screening people. We were screening people with no mask at a table with our front doors of the clinic, which if they're broken, they're automatic doors. It works on, they're handicapped ADA doors, but they're broken, so the doors kept going open, close, open, close. So initially they wanted us to leave the doors open, and so they would sit at the table all day and collect and ask people if they had cough and fever. And so with no protection. And some of these people that were coming to this site, this is also an ATS, alternative test site for COVID-19. So those people would come. And some of these patients, because of language, differences in language and ability to cover all the languages when the patients would come to the desk, some would walk up to the table on the worker, and some worker was even exposed by cough. Myself, today, a patient walked up and they coughed and I was exposed. So we have no protection. We have no mask. We have no gloves. We do have hand sanitizer. We have no shield. Now, I can tell you at San Francisco General Hospital, where my constituent Brenda Barrows works, they were able to, she's working at a screening table, but they were able to get a barrier within a day, a plexiglass barrier where the worker is behind. And then also the administration at the hospital gave all the workers masks, gloves, hand sanitizers, everything that they needed. And plus they were inside the building. But at Southeast Health Center, we were placed outside the clinic. We were the only group that was placed outside the clinic to screen all these patients. I don't know if it's because we were an alternative test site and a primary care clinic at the same time.
And are there any signs in different languages, so if people come there, they can get instruction about what they should do and to protect yourselves and them from any further infection?
Well, we do have some signage up. We had in different languages. It's about if you're coughing, cover your mouth with the picture. But some of the patients that are coming there that don't speak the language, they don't adhere to the sign. They just see you at the table. There's nobody at the table, and we're trained to come up to the table. They're trained to come up to the table. To the worker and speak to them. So that's how they're trained, and so they don't notice they're 6 feet away. Some people are not practicing social distancing. But yeah, at the Department of Public Health, we're getting the frontline workers. And when I say the frontline workers, eligibility, health workers, things like that, people that work at the front desk. We're being put out there on the front lines with no PPE, no protection whatsoever, in the cold with 55 degrees and sitting in the cold. And no one even did a risk assessment on us to find out if we had underlying medical conditions and we shouldn't be out there. We're trying to be at work. They asked us to be at work as essential workers, but yet they're putting us out there on the front lines with no protection.
And where is Cal OSHA? Has Cal OSHA been there to investigate the conditions of the workers, whether your health and safety is being defended?
Well, I don't know about Cal OSHA, but our own internal OSHA department. I was on an email thread today asking because, when I complained about the disparity in how, like I said, at San Francisco General Hospital, they had protective barriers for the screeners versus at Southeast Health Center, nothing. I was on an email chain thread this morning, and the head of our OSHA department, Ed Ochi, said that there was somebody that did come through and walk through the clinic, but he said he couldn't remember who. It was very vague. I sent him pictures of us sitting outside with no protective barrier, very little language material. Oh, and the other thing is, at our clinic, there's a shortage of masks. So patient masks. So at the beginning of each shift, there's no mask, and we're given 5 masks. Well, 2 times today. In fact, when the woman came up with the cough, we were out of masks. We had just run out of masks. So you see, they were only giving us 5 masks. We have no masks. We have no materials to work for. We're just out there sitting ducks. And if we don't go out there, they're going to say we're insubordinate. They don't care about Cal OSHA. And the person in OSHA, I guess he's down at the EOC, and because there's so much going on with COVID-19, there's no one to assign to Southeast Health Center. So we're just left out there on our own, black workers. We're at the bottom of the list. There was a hearing in 2018, and it showed that data that black workers, there's a huge disparity, and you see it in this environment as well in COVID-19. Here we go with the disparity once again. We're thrown out there in the front lines with nothing, no resources. No other clinics in these other districts have been asked to do what we're doing at the front desk at Southeast Health Center. And again, I think it's because we're an alternative testing site. Oh, and one other thing I wanted to mention. Like these alternative testing sites are popping up. We're actually, the mayor signed a declaration to activate disaster workers. So right now we're in the category, you're in the category of as an essential worker until they send you a letter and you're activated as a DSW. Now, what's not very clear to me is as a DSW, I know you get a letter and it tells you the duration and where you're going to report to, and it's temporary. But I'm not sure if there's other things that are afforded to you because you're in this special category. But why I raise this is because they opened an ATS site at our clinic, which is to respond to testing for COVID-19, but no one was deployed there through the mechanism as a DSW. What I'm saying is the workers were not they were not given a letter to say they were now activated as DSW workers and they would go work in these alternative testing sites and what to expect.
And SEIU 1021, you're a member of it, you were a shop steward. What has the union done to protect yourself and other workers? They have over 55,000 members. Do they have a health and safety director of the union? What are they doing to protect yourself and others who are frontline workers dealing with the public and trying to protect the health and safety of yourselves and the public?
We don't know what SEIU 1021 is doing right now. It's unclear to most members. I am the vice president of our community health chapter. And as an officer, I have gotten very little information. I know they said that they were going to be meeting with the city and trying to put some stuff together. And on Saturday, we did receive something from our DHR. It was in a draft that was sent out to us, PDF. It was a draft PDF. But it did try to give us offer guidelines to what should happen in the COVID-19 environment. But no, SEIU, as far as I know, I don't know who that person is who's over OSHA, and I don't know what they're doing. Like I said, I work at Southeast Health Center, and I've been contacting SEIU 1021. We need help right here at our clinic. Our rights are being violated. We're being put in harm's way. Our families are being put in harm's way, and nobody is coming to our aid. We're just we're like a man on an island by themselves.
And does this surprise you the way you're being treated now, or does this have a pattern?
Oh, this is a pattern. I was on a call. It was Alameda County, Cocoa County, Stockton, and San Francisco late last week. And the call initiated about frontline workers not having protection at all these different hospitals. And Highland Hospital was gearing up for a big protest last Thursday because they really were short on resources. And nowhere did you see SEIU 1021 really, really present there to stand up for those workers, to say, wait a minute, we're going to push back. But another thing is, Steve, we want our union to take some of our union dues and buy some PPEs for us and ask the city to reimburse them. And we also want the union to file a complaint with the state Cal OSHA to find out why instances like we, frontline workers, are working out of our scope, being put in harm's way, and we're not even given a DSW status. I think our rights are being violated at a city level, state, and federal level.
And do you think it's time for workers of this country to start to really organize and build a national campaign to unify? Because it seems like essential workers, frontline workers, are basically getting the shaft right now all over the country.
Oh, absolutely. And I think I want to relate this back to, I think there's something else happening here. Some of these managers and directors are using this as an opportunity to do a reorganization in disguise. And what I'm saying, once again, I think privatization is at foot here. And I believe that that's why our workers can't be defended by our union, because our union is so busy in bed with management and doing us in that we cannot get the protection that we need. Now, look, we pay a lot of money. I pay, I think, about around $120 a month union dues. And yet, I haven't seen a union rep come to my work site or at least place a phone call to ask how we're doing as members. Do we need anything? Is anybody in our family affected by this COVID-19? What can we do? Nothing. There's nothing. Just crickets. Nothing. But they're asking for your money. Your member dues, they want those for sure.
And you've reached out to the union, and and management has basically ignored your need for protection. Where is this going? Because it seems like this epidemic is growing. It seems more and more people are getting sick. It seems like they're ready to basically leave the workers out on their own, threatening their health and safety and that of their families.
Absolutely, Steve. I have workers. I supervise 3 work sites, and I have workers who have underlying health conditions that the CDC has identified as high risk for this COVID-19. Now, the city relaxed their guidelines. The mayor put out a directive March 17th when she talked about we were going on lockdown. And she recommended that if you were over 60, if you had diabetes, cancer, HIV, lung disease, any of those categories, that you would be considered for telecommuting. And the interesting thing is, Steve, here's the thing. Like at our work site, all our work has, for the most part, 99% has become telemedicine visits. So we are calling patients to do our job, our interviews over the phone. With Epic in play, there's no reason why you can't send frontline workers, black and brown, home so that they don't spread COVID-19 and that they don't get it and they don't jeopardize their loved ones and family, and yet they can get productivity done and still serve the public. But that is not what is going on. We're being thrown out there on the front lines to be infected. I don't know if the city just wants black people dead or poor people dead. I just don't know, but they don't care.
Okay, well, I want to thank you for joining us on WorkWeek. We've been talking with Cheryl Thornton. She's a shop steward and member of SEIU 1021 on the front lines at San Francisco General Hospital, but all the community centers of San Francisco, where people are coming to these community centers to get information and support, and the workers that are servicing them have no protection, which is really criminal. So thanks for joining us on WorkWeek.
Thank you, Steve.